Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Aletia Farmer, who is an internist with Family Practice Associates. Welcome.
Well, thank you, Dr. Fox.
Now, you've been doing this long enough to see some cholesterol changes over the years, but we've got some new guidelines out. But before we get to that, let's talk about cholesterol. What is it and why should we even worry about it?
Well, cholesterol is a good thing when we have it in the right amount. It's what makes up our cell walls and different products of our bodies like steroids, and we also need it just as a micronutrient. But if we have it in too much, it lends to stroke and cardiovascular disease and heart disease.
So plug those arteries. So if you've got bad cholesterol, you want to get rid of it. And I use the term bad cholesterol. What are some key changes with the new guidelines?
Well, we're going back a little bit. The American Heart and the Cardiology guidelines came out, and we're now really focusing on getting goal LDL reductions, and it's all based on their risk factors.
Okay, now LDL is the bad cholesterol.
Correct.
So numbers and risk factors correlate?
Yeah, they do. They correlate pretty well. If you're looking at someone who has like low risk, and we have a new actual calculator that we figure out that risk, then you feel pretty comfortable about maybe talking to them about starting a statin versus doing lifestyle risk. But once you get into like that intermittent and high risk, the reduction in cardiac events, heart disease, heart failure, stroke, it's over 50%.
Okay, now, are there some numbers, if you know your LDL, there's some numbers you should pay attention to?
So if you have an LDL that is really high, the newer guidelines also bring up that if it's over 190, then that's probably familial hyperlipidemia. And so we have new guidelines to actually go ahead and test for specific things like the lipoprotein A, and we should already go ahead and not really do the calculation and just start them on a high dose statin.
Now, they also screening at an earlier age now?
Correct. They want everybody in their lifetime to have a lipoprotein A, and they say even before 40 if you have strong family history of heart disease. Lipoprotein A is a completely different protein. It's very, very specific. It doesn't change over our lifetime, and it's independent of the LDL, diabetes, other hypertension, other risk factors. So it's really going to pinpoint those people who have a genetic disposition of having high cholesterol that leads to early heart disease.
So somebody in your family's had high cholesterol, stroke, or heart attack, really important to get screened for that.
Correct.
Okay, now let's assume you've got bad LDL, you've got all these risk factors, and you're going to take a medicine. What kind of options are there, and what's the risk benefit of the medicine?
So the guidelines say to first start, if you're in that low risk category, with the lifestyle changes, and still starting with like the Mediterranean diet, going ahead and looking at cutting out those high fats in your diet, more omega-3s, more plant protein, fruits and vegetables, cooking with olive oil. But once you get into that intermittent risk, which is going to be a lifetime score of about 3 to 10% in the next 10 years, you should start on a moderate statin. Once that goes above 10% in the next 10 years, then it's definitely going to do a high dose statin. And statin is still the first line drug.
All right. Well, thank you for coming in. Thank you for telling us about it. Thank you for taking care of our cholesterol.
Yep. Well, thank you, sir.
All righty. We'll be right back.